Welcome back to this special edition of LDN ONT TV on Rogers Television. I'm Brona, your host, and I've been talking to some fascinating members of the London Southwestern Ontario community. And here's another one. His name is Dr. Mohammed Bayabad. He is the founder and executive director of the Muslim Resource Center for Social Support Integration. And he has a lot to say about some of the things that we were talking about with our other guests about the importance of really building community and integrating our humans and our services and our institutions together for positive change. So welcome to the show.
Thank you very much for having me on your show.
Thanks for coming. Yeah. So can you talk to me a little bit about the idea behind the Muslim Resource Center? A little bit about the history and why it was important for you to set up this awesome institution.
Well, thank you very much for having me. And I think really it's a very good question. The Muslim Resource Center for Social Support Integration was established in 2009, but there is a history before then. And I think really, the Muslim Resource Center, I would see it as a result of a collective efforts of the London community to address sensitive issues, including domestic violence. So I can give a little bit context about where we started and why we started this, organization. Actually, we started this work around 2003. Basically, the anti-violence agencies, in particular, Violence Against Women organization, assuming at that time that or maybe they are witnessing less Muslim women accessing their services. At that time, I think the assumption was maybe there is something related to the religion of Islam that prevent women from asking for help. So the assumption was maybe Islam, would tolerate violence against women. And on the other hand, some Muslim community leaders also were thinking, shelters, police, and other mandated services are encouraging women to rebel against their families and also children against their parents to break down families. So that was the kind of misconception, misunderstanding, or maybe myths that, around the issue of domestic violence. And that was the reason why we started from the beginning a group of us, including those who really were at that time in the area of family violence, domestic violence, including the London Coordinating Committee on Women Abuse, changing ways at that time. So we started the project actually with having a difficult conversation where we brought mainstream service providers and leaders of the Muslim community to start having a conversation about their concerns, working together in the area of domestic violence responses. So this conversation, led us to a place after a few years to realize that what we really need as a community at large, an integrative resource or integrative services. Mainstream service, mainstream services would not necessarily all the time meeting the needs of families impacted by domestic violence coming from a different cultural background with different migration experiences. So then we need to have something that integrates this best practice within the cultural context. So instead to look at the religion and culture as a problem, try really to see the strengths within the religion, the strength within the culture, and to encourage those kind of elements to prevent violence against women, but also really to intervene as early as possible. So that is really the history of the Muslim Resource Center. So at one point, then we found that we need, more than outreach to the Muslim community. We need to have an organization that acts as a coordinating body to facilitate all the services available within the Muslim community and outside the Muslim community to support families in particular who may be experiencing or at risk of family violence. So, and that's why we decided at that time to establish the Muslim Resource Center as an initiative of some individuals in the Muslim community in collaboration with other people from within the broader community. Like, for example, we have on our board, on our staff, volunteers, from different cultural backgrounds, different religious backgrounds, but they really agree that we need to work together. And I really like what Dr. Javid said, really working together towards a constructive solution. And the MRC, the Muslim Resource Center, actually embodied this concept of working together. And sometimes what would happen if people would not create a safe space for everyone to have a difficult conversation, they will be always seeing each other as enemies. They were not going to, work together. So then that is going to impact the people who we want to serve. So the Muslim Resource Center actually, is a reflection of a collective effort, as I said. People come together and work together to address sensitive issues. And I really think that is really what we should do. We need to continue this kind of difficult and tough conversation to address any other issues that impact our community at large.
Absolutely. And I know, from its roots in addressing domestic violence and violence against women and throughout the community and all of your work to integrate with, your efforts with other organizations in London, you've obviously grown over the years. And now there's many other aspects to MRCSSI in terms of your programming. So you've grown to serve, people who are new to Canada, for example, to not necessarily as a settlement services, but more to help them help them learn about Canadian society, help them with any kind of stresses that they have from coming into this new country and this whole new environment. So can you talk to me a little bit about how you developed those kind of programs over the years?
As I said, we started actually to address domestic violence and to really develop culturally informed and culturally meaningful responses in collaboration with anti-violence and social service agencies. But we realized it's not just really about domestic violence. So domestic violence, like any other social problem, have different kind of dimensions. So there are different factors that could be maybe considered as risk factors, but also there are factors who could be considered as protective factors. And because of that, if you look at the title, the name of the Muslim Resource Center is on social support and integration, which really means we try to provide community, social, and psychological support for community members, in particular families, including those who are coming new to the country and coming from conflict zones with pre-migration trauma experience, or maybe with post-migration stresses, to help them overcome any challenges that could impact their integration. So if you have really good, community and social support, that would really set stage for positive and safe integration. So that is really where then we expand our programs. We have counseling programs for families, for individuals, for couple. We have group programs like the Strengthening Family Program, where we bring the whole family together for 14 weeks, get together and learn different techniques to, address difficulties in the, family relations and improve communication. And that has really also huge impact in the well-being, psychological, emotional well-being of individuals, in particular children, but also, the family. So basically, we started to look into different kind of ways to provide enough support for the community. We also, do a lot of prevention work, through education. We do a lot of education, with the community. We educate the community on different issues, including family violence. At the same time, we work with mainstream service providers, train them to be more culturally sensitive and culturally responsive in their work with our community. So even though we are working with the Muslim community, but it's not really limited to the Muslim community. So that's the kind of work that we have been doing. Also, we also conduct research, because research will help us identify gap of services. Right now, we're working on a new model to respond to family violence. We call it culturally integrated response, family violence responses. There is a project that we are working now with ANOVA, the Center for Violence Against Women and Children at the university, as well as CAS and the police. We're trying to figure out collectively in the community what would be the best way to keep women and children safe, but also maintain their connection with their families and with their culture and their community. So that is something that maybe sometimes we try to avoid, because really not anybody would like to go this fine line. We try to work together. So if we work together, we can find constructive solution. So we have a lot of programs for kids, for youth, for families, and also for the community at large. So that's basically what we are trying to do. And we just started with maybe 3 people. Now we have about 25 people working with us. One of the strengths really of the Muslim Resource Center is collaboration. So we created a safe space for everyone. We work with with difficult situations, but we bring people together. All of our work is really has been done really collaboratively, and I really think community-based coordination, service and support has better impact, and also really it would have a more positive outcome for the families and individuals that we serve.
Absolutely. So, hard conversations. We have to have hard conversations if we want to address big problems. Mm-hmm. Obviously, we want to be able to, make a space where people can feel comfortable interacting with members of their community and really coming up with constructive solutions. Mm-hmm. And I think that is one of the things that's really important to you, is to move forward with positive solutions to big problems in the short term, but also long term. So talk to us a little bit about, your, philosophy of how we're going to address these bigger problems. Yeah,
I think, for example, just really in light of the current tragedy that happened in London, this really terrible tragedy, I know people are really, looking for a short-term solution. People are angry and upset. We all are impacted by that. I think I see that also as an opportunity when I talk really moving forward, without undermining seriousness of this tragedy and its impact on the family, but also on the community at large. I think we need to see things beyond this wound. And I really seriously say that, because I have gone through the experience with the Muslim Resource Center when we brought people together and to really, think together and learn from one another. So when I see tragedy, but also I want to see the other part of it, overwhelming support that we have seen over the last few weeks, that all London came out to support our community. We don't want to also undermine this. We need to take note of that and build on that as we are moving forward collectively as Londoners, but also as Canadians. So I already started, a conversation with the, many Muslim community leaders, but also with the mainstream service provider. I had a meeting with the CEO of United Way, with CEO of London Community Foundation. I would like to thank them for also supporting MRC in this. We are working. We met with CCLC, the executive director. We are going to meet with ANOVA next week. Basically, what we are trying to do in collaboration with United Way and the City of London, we want to bring all the service agencies together. MRC by itself cannot really respond to the needs. And that's really what I think the starting point should be. We bring, because all these resources are our resources. We don't want to replicate or maybe to reinvent wheel. We need to bring everybody on board. MRC actually can play a very critical role as a broker, not really interpreting or translating for clients. No, we work together with whoever, for example, individuals, professionals, or maybe service providers. Let's figure out what are the struggles of these families that we go through. Currently, I believe psychologically, people are in the state of shock. We don't expect that many people will come and ask for professional help. They will go to their friends, to their family members, and they will really try to figure out, make sense of what is happening. But in a few months from now, we will see really the real impact of this tragedy on many people. And because of that, I think really We are not a crisis intervention agency. We have been doing this work for many years, and we really try to make sure that the people who need help surrounded, with a circle of support. You need a lot of support, whether it is psychological, social, community, spiritual. Faith support is very important. We are the only organization here that integrate faith support within our social and mental health service and support. So I really, I would really send this message to everyone. Reach out to us, whether organizations, individuals. Let's figure out together how can we move together to really create what Dr. Jared said. Together to work together to for a constructive solution. I think there is a lot of potentials here. Let's be positive. Let's really believe in our strengths as a community that come together and to address difficult issues. Nobody is going to help us. We need to figure out the best way to work together. And also really I want to mention that also we have some conversation with the victim service at the police. We started a series of community consultation. Last week we had a program that we conducted with the victim service at the police. This week also we are going to continue our conversation. But instead to really just jump and provide service, we need to create a safe space for everyone through a community conversation and figure out what people need, and people will tell us what they need, and we try to tailor different kind of support for them that will help them short term and long term. So that's really what I think moving forward we need to do.
Well, I think that's really inspiring, and I think you've probably convinced a lot of people to engage with MRCSSI in future. I know, I'm convinced. So we'll thank you for coming on LDN ONT TV today, Dr. Baobed, and we're going to have to take a break. Please stay with us. We have another fascinating guest coming up.